All right, good morning, everyone. Thank you for joining us today for our COVID-19 update. I'm here today with Dr. Terraza, our Health Commissioner, Police Commissioner Harrison, and our Fire Chief, Niles Ford. As of right now, we've had 32,495 reported COVID cases in Baltimore City. We have also seen a 19% decrease from the previous 4 weeks. We have 392 people hospitalized with COVID-19. Our ICU utilization rate is at 87%. Acute care utilization is at 85% in Baltimore City. We have seen now 649 deaths from COVID-19 in the city of Baltimore, and we're averaging over 3 deaths a week to COVID. I want to thank everyone who continues to take COVID-19 seriously by following the guidelines, protecting themselves and their families. I want to thank those who found new ways to celebrate the holidays with their families this year in this holiday season. We know that this was a difficult thing to do for all of us. We have been coping with this virus for longer than any of us had imagined in the beginning. And the efforts to keep yourself and those around you safe, from wearing a mask to washing your hands to not intermingling with households, all of it helped to slow the spread of this virus and to keep people safe. In addition to taking those steps, we must now begin and move into ensuring the successful rollout of the COVID-19 vaccine here in Baltimore City. This morning, Dr. Terraza and I will outline the COVID-19 vaccine distribution plan for Baltimore. In December of 2020, pharmaceutical companies Pfizer and Moderna were granted emergency use authorizations by the FDA for COVID-19 vaccines. The Baltimore City Health Department has received the first doses of the vaccine and has a plan to administer it. The Health Department has already begun vaccinating health professionals who will be vaccinating other people. I'm going to turn it over now to Dr. Terraza for more information about our COVID-19 vaccine plan. Dr. Terraza?
Good morning, and thank you, Mayor Scott, for continuing to lead and inform the public about Baltimore City's COVID-19 pandemic response. As Mayor Scott mentioned in our COVID metrics updates, to date we have lost 649 lives, and we're averaging just over 3 deaths per day, with over 32,000 cases here in Baltimore City. There has been a 19% decrease from where we were 4 weeks ago, but this does not reflect the time frame where we would see potential cases from all of the recent holiday gatherings. Our hospital utilization rates are trending in the right direction but remain high, with ICU at 87% capacity, and our acute care is following closely behind at 85% capacity, slightly higher than those numbers were a week ago. Today, the Baltimore City Health Department is beginning its pod vaccination structure as a part of its citywide vaccination strategy. The Health Department received its first 100 doses of vaccine the week of December 20th and used those last week to provide immunizations to public health staff who will be performing vaccinations. We've received a second batch of 2,600 doses last week, and we will begin using those doses today to vaccinate healthcare workers and our first responders. Health Department staff will be pre-screening individuals to determine if there are any contraindications or precautions as a part of our vaccination process. We are working to assure a smooth and efficient rollout of vaccine here in Baltimore City, using the ethical principles outlined by the CDC's Advisory Committee on Immunization Practices. Maximize benefits and minimize harm, promote justice, and reduce health inequity. Due to limited initial supplies of vaccine, the Health Department has worked closely with the Maryland Department of Health and other local health departments across the state to develop priority groups and sub-priority tiers for allocating the vaccines to ensure a near consistent prioritization across the state. In Baltimore City, we took into account specific population factors and priorities to tailor sub-prioritization to meet the needs of Baltimore City residents. For more information on these specific tiers, visit coronavirus.baltimorecity.gov/COVAX. We are in the We are in the early stages of the vaccination process, and it's important to keep in mind that at this stage, there is still a very limited supply of vaccines. We will continue working closely with the CDC and Maryland Department of Health in the coming days and weeks to rapidly administer vaccinations.
Can I get next?
As we work to get vaccines administered,
Please don't
it's
ask me to be
important to
quiet.
continue following COVID-19 best practices. Please continue to wear face coverings, avoid large gatherings, and practice social distancing. The vaccine is here. It's no longer a possibility. It is a reality. But that makes lives lost today to COVID-19 all the more tragic because the possibility of prevention through a vaccine is so close at hand. We are continuing to experience widespread community transmission. Even with the slight improvements in some of our metrics over the last few weeks, we continue to see a very high amount of COVID-19 circulating in the city. Please take all available precautions now so that we can prevent cases while we work to get people vaccinated. Thank you.
Thank you, Dr. Duraza. We are excited that the vaccine has arrived here in Baltimore, and we will begin, as she said, administering that today. We are grateful to the Center for Disease Control and Maryland Department of Health for making these initial allocations to Baltimore. And we will continue working with them to ensure a steady flow of doses into the city. I would also like to thank Under Armour at Port Covington campus for making their space available. Before we close and take a few questions, I wanted to address the mandates I put in place, restricting in-person dining and activities that require you to remove your mask. Shorty, pull your mask up, man. Pull your mask up. We are heading into the 4th week of these mandates, and I recognize that Friday will hold on one second. Shorty, come on, man. Look, people dying, Shorty. You know I don't have no problem with that, but people need to hear this information because they dying. No, not you. People dying, Shorty. Hold tight for a second. We are heading into the 4th week of these mandates, and I recognize that Friday will mark a month. I'm cautiously optimistic about our trends based on what we've seen from the cases. However, what we have consistently seen is spikes in cases following holidays like Thanksgiving, Hanukkah, and Christmas. We are anticipating a similar spike following New Year's. Thus, I am making 2 announcements regarding our current mandates. I will be looking at the data closely in the coming days with our health commissioner and hospital partners to see what, if any, impact traveling and gatherings around the New Year's holiday have had on our data. This Friday, January 8th, I will make a decision regarding our current guidelines after fully assessing the data. We will be considering case rate, positivity rate, hospitalizations, and deaths. We also rely on projections from our hospital partners. All of that data and expertise informs the decision that I make and will continue to do so. Additionally, based on the input that the city has received from the community, I am committing that any change to the current guidelines will be given with 1 full week's notice, barring any emergencies, allowing those industries and individuals the most impacted to make adjustments as necessary. This is the sole reason for doing that, to make sure that we communicate in a much better way. As always, our decisions in Baltimore will continue to be guided by the science and our public health officials as we navigate this pandemic. And at this time, we'll take a few questions. Jane? Jane?
I would assume that the main restriction you're talking about has to do with the restaurant closures. So are you saying that on Friday, you will decide whether that restriction is going to remain in place or will be somewhat lessened?
On Friday, Jane, we will have an announcement based on data, the data that we just laid out, on how we will make that decision, what kind of things we will be saying, and that decision will come on Friday based off the data.
Can I ask a question of the vaccine plan?
Sure, go ahead.
So the 2,600 that are starting today in the city, those are separate and apart from the hospital workers that are being vaccinated separately. Am I correct? This has been a really confusing process. No, so hospitals are responsible for immunizing their healthcare workers. So hospitals receive separate allocations from the health department. We're responsible, again, for our vaccinators, so kind of our frontline healthcare workers that are vaccinating and testing and caring for COVID patients, as well as first responders in this first group. So the first responders include police and fire? EMS, yep, starting with EMS, and you're right, law enforcement. And so they're starting today? They're starting today. Is there reluctance among any of these groups to receive the vaccine? I think there's reluctance generally around COVID vaccinations. So when we were doing our flu vaccine strategy over the summer, we had lots of focus groups and gathered information from the community. And I think there's hesitation, certainly we know in the African American community, based on years of medical mistrust and structural racism. We know that there's also concern in the Latinx community. We know there's concern with parents with children. So I think the hesitation that we're seeing is not necessarily limited to one group. It's relatively widespread. So in addition to COVID vaccine dissemination, a big part of what we'll be doing is education as well.
Question for the health commissioner while she's up there. I spoke with an expert at Johns Hopkins yesterday about the vaccine distribution plan, both in the city and in the state. He indicated that there may be manpower issues with not enough people trained to actually administer these doses. What is the city doing to make sure there are enough people trained to get these doses to the people that need them?
So we're really fortunate to work with Maryland Responds. So Maryland Responds has provided us with a number of clinical volunteers to help with support. We have clinical staff as well within the health department. I plan to get trained on administration as well, though I'm not sure when I'll have time. But yes, we're working on that. And again, Maryland Responds has been a great partner providing us with additional clinical support.
Okay, thanks so much. And for the mayor, I wanted to ask too, surrounding jurisdictions have continued to participate in both indoor and outdoor dining, many of them still seeing relatively packed businesses up to those restrictions of 50%. What are your thoughts about people from Baltimore City leaving the city to go and spend money and dine indoors and outdoors in the surrounding jurisdictions?
I can't be more clear about this, right? This is about saving lives. And we know again and again, not just for us, are we worried about saving lives, which is also the most important thing, period. You can't eat, you can't drink without having a mask off your face, period. Also, what I just want to remind folks is that here in Baltimore City, we have 11 hospitals. So when people get sick, as they did throughout COVID, if they get sick in Howard County and Baltimore County or wherever, you know where they end up? They end up here. So we have a higher level of responsibility. We will look at the data and make a decision based off health data and health data alone. This is a health emergency. Everybody wants to. Everybody wants to go back to normal. But we're not going to get to that point until, look at us versus the rest of the world, right? We have to get to that point. We have the vaccine now, and we just need folks to follow those restrictions. Health data only.
Thank you, sir.
Next question. Yes, ma'am.
For the health commissioner as well, can you speak to the plan to vaccinate private healthcare workers and dentists, and when they fall in terms of priority?
So again, there are a lot of phases and tiers, and so I don't want to steer you wrong. They are included in our phases. The best place to get the most up-to-date information is going to be that website I mentioned, coronavirus.baltimorecity.gov/COVAX. So we've outlined all of our phases and all of our tiers on that website.
Do you have a specific plan in terms of vaccinating them? Will you be working with CVS and Walgreens? How will that?
So right now, CVS and Walgreens have a partnership with our long-term care facilities, and so they've worked closely with them. We are looking to work with additional partners for vaccinating other healthcare workers and others in the priority groups. Currently we have a pod structure, so we have a physical location where people would go. In time, similar to how we started off with one testing site, I think that there will be expansion and there will be more opportunities and access to vaccine. So we're still in the planning phases for that.
Next, go ahead, ma'am.
I just wanted to know, regarding your decision that you're going to make Friday, I'm kind of curious what kind of things you might be considering. Obviously, we're not going to get back to normal, but is there anything that's off the table? Like, for instance, indoor dining? Like, is that just something that you wouldn't even consider?
No, we're going to be guided by the data that we reference, and the data will guide our decision. the data, and again, we are looking at the information coming out of the New Year's holiday as we saw spikes around the holidays. That's what will guide the decision, nothing else. Last question.
Another question about the vaccine plan. There's been a lot of confusion about who's in charge from all levels. So going forward, first of all, how many doses do you anticipate receiving in the city weekly, daily, however they come in? That's number one question. And then second, is the city responsible for its residents outside of the hospital system? Okay, good question. So the first question, we're informed on a weekly basis what will be coming to the health department. So there isn't currently a set amount that we'll get each week. Each week we're in communication with the Maryland Department of Health, and they, provide us with the allocation based on what their supply is. So again, I want to stress that though we're seeing vaccine, the supply is still limited. And so, I think as it becomes more available, we'll see more allocation, but again, the supply remains limited. The city is responsible for immunizing its residents. Again, we're working through the phases and we'll be working through the tiers, but we do have a responsibility for the population, working with healthcare partners and other providers.
Thank you, everybody.